If you have ankle pain, this guide will tell you exactly what to do about it and exactly what's wrong with you. So you have lots of different sprained, broken, injured ankles. Which one's which? Well, this will tell you what. Generally, if it's minimally swollen, a little bit of bruising, it's sprained. But if it's really swollen, deformed, broken looking, then it's broken. It's that simple. Otherwise, here's even more depth. If your foot was not planted and you turned in like this, likely you have a low ankle sprain. If you twist it on the inside, an eversion sprain, you have an inner ankle sprain. There's different types of sprains, which makes it confusing. There's three grades, with the thickest grade being a complete tear through the ligament, and you can see just how swollen your foot is, sometimes even more swollen than a small break. That's what makes it tough. So using an ultrasound in our office, we can see if the actual ligament is ruptured. Otherwise, intraoperatively, here's what the ligaments and tendons can look like when they become ruptured. A high ankle sprain is, you can see, not the ones in the ankle, but up between the fibula and the tibia. This is when your foot's planted and your knee buckles and twists in. Same thing, you want to get an MRI and an ultrasound and an x-ray to see if the clear space between the two bones has enlarged. As you can see, here's a surgery to bring the two bones back together so that the ligament can heal in between. A broken bone most likely going to look like this because there's a lot of bleeding on the inside. You can see that the bone's actually snapping. The mechanism could be a few different ways, but generally it's a very high trauma. So you can see an x-ray, a lot of damage here. This is an obvious break. You don't need an x-ray to tell, whereas an MRI can help tell you some of the smaller ones. CT scan, same thing. You can see that you can have a break without a whole lot of deformity. So you could see those situations where a torn ligament could sometimes cause more bruising than a small fracture. So the bottom line is a low ankle sprain is a twist at the foot that's not planted. There's less bruising unless it's fully torn. A high ankle sprain, same kind of thing, but your foot's planted and you twist through your knee. A broken ankle, usually you see some deformity, some blood, some trauma, and you cannot put weight on it. Although that's not to say you can't put weight on any of them. So you turn your ankle in like this. It's a low level sprain. Here's what you want to do: rest, ice, compression, elevation. I see on YouTube some people are complaining about these things, but the bottom line is there's proof about these things. The biggest controversy is icing. Do you want to stop the inflammatory cascade? Listen, this isn't an infection that needs to be cleared up first. It's a lot of swelling, a lot of tenderness that keeps you in pain. The more you can control that, the more you could compress, the more you can elevate, the faster it's going to get out of the inflammatory period and move towards the actual rebuilding stages. So the evidence still shows you want to limit your inflammatory phase. Where people get confused is you don't want to limit the inflammatory phase in things like flu and a cold, because that actually prevents your immune system from attacking the bacteria. That's simply not true for an acute injury where you don't have an infection. So things you want to do is icing, biofreeze, menthol gels. All these things have been proven to relieve pain, decrease swelling and symptoms. Still controversial, still a lot of conflicting studies, but overall most people agree that these things work well. Anti-inflammatories, you don't want to go with a Tylenol or an acetaminophen because, as you see, it reduces fever and reduces pain, but aspirin and ibuprofen are more inflammation reducing, which is the problem with the ankle sprain. So the thing is, the biggest predictor of how long it will take to heal is it sprained, or is it torn, or is it something in between? If it's torn, you're looking at 12 weeks. If it's just sprained, you're looking at 1 to 2 weeks, maybe even within a couple days, depending on how minor the sprain is. So at this point, you're just compressing, you're icing. The biggest place you can make a difference is supportive ankle braces. Braces like this with the tongues that come around, this is going to give you a ton of support. These two down here, this is more of a compression type brace. If you have a good shoe and a solid brace, you can walk as much as you want and it's not going to strain those sprained ligaments. So if you're wearing these, you're functional almost immediately without a lot of pain, and your healing time is faster. These are the real key to this. And if I can give you one important thing, I would say this is the most important thing: Don't start exercising until it's healed. You don't want to exercise a torn ligament. You are going to damage it faster. These exercises are meant for a chronic recovery after the initial ankle sprain or tear has healed. So get imaged first before you start doing any of this crazy stuff. So that's the main thing. If you're in a grade 3, you are crazy to start exercising it. This is different than just moving your foot up and down for blood purposes, but if you're putting pressure on these ligaments, they will not heal. So level ankle sprain, you want to wait a while. If it is ruptured, if it's early, you can start moving quicker. The only way to really know is to get it imaged or evaluated by a professional. Same thing for high ankle sprain. I'm just repeating the same stuff. Rice, use the same stuff. Use the same stuff. If it's a tear, it's going to be longer. Kind of like Terrell Owens in the NFL, even doing all the right stuff, it took him a couple months to get back for the Super Bowl. So, same thing, you want to use the brace to stabilize, and then when you get a break, all you can do is still do the same thing, but this time you're going to be wearing a cast or a boot and protecting it with absolutely no pressure because your bone needs a long time to heal. This is where the big stuff comes in handy. If you travel a long time, get yourself a knee scooter. Me personally, I hate crutches. I think people fall over and injure themselves. They hurt their armpits. I personally think they're just the cheap route to go because they're easy to have on hold in the emergency room. If you can get over the stigma of looking like an 80-plus-year-old, get yourself a walker. You will feel much more comfortable. You will do much better in life. Walker is the way to go, although you don't need the basket. So same thing, after you get out of the cast in about 6 weeks, you still want to use a brace to stabilize yourself. Stability will let you heal faster and easier. So the bottom line is a broken ankle. At 6 weeks, you're about 50% healed. At 12 weeks, about 75% healed, and at 6 months, about 95% healed. This is a generalization, but roughly I find this to hold true. So, if you have any problems with your ankle sprains or possible broken ankle, come see us. We would love to help you. We have offices all over the place, so come let us know. If this helped you at all, please visit our website where you can get even more information. And if this video did help, give it a like and a share, and we'll see you soon. This is MichiganFootDoctors.com.